Hi everyone. So today I'm joined by Gagan, and Gagan is a pediatric physiotherapist. And Gagan also runs a page on Instagram where she shares a lot of tips. So you can follow her page as well. I will be sharing the details at the bottom. Very welcome to you, Gagan. Thank you so much for joining me today.
Thank you so much, Jagjeet, for calling me here. It's really an honor for me. Thank you.
Not at all. Not at all. Honor is all mine. Thank you, Gagan. So, Gagan, starting off, tell us a little bit about how did you get interested in physiotherapy in general, and how did you eventually choose, pediatric physiotherapist therapy? Sorry.
Yeah, so about physiotherapy, basically, someone told me at that time the physiotherapy was not a big hype or anything. So, someone told me about it. I gave the entrance exam and I cleared it. Then, pediatrics became my passion during my internship. So, during my internship, where I was working, I worked with few kids and I loved working with kids. And that's when I thought, okay, I'll do my master's in neuro because pediatrics was not an option where all I applied. So I did masters in neuro. Then my husband got posted to Mumbai, and I got the opportunity to work under someone who has worked like since 30 years in pediatrics. And that's how the journey then started into pediatrics itself. Then I went for a course, the NDT certification, which is neurodevelopmental therapy, to States 2 years back. I did that, and that is helping me continuing the education, learning more, and everything. Yeah, so I love kids. That's the baseline.
That's amazing. Thank you, Gagan. So as we discussed some of the questions prior to our discussion here, how about we start with the pelvic health for women, for the mothers to be. So how would you go about that?
So yeah, so this is a topic which is not much talked about, especially in developing countries even more. There are issues which come later, like incontinence, back pains, those kind of issues which people generally don't relate to the pelvic health part of it.
Yeah.
So it is really, really important for mothers when they are starting to plan for a pregnancy to go check their pelvic health and work on the exercises, even postpartum. Generally, everywhere in the hospitals and wherever they deliver, they are only told about Kegels exercises. So Kegels is not, that is it. You need too much more for your pelvic health to do. Just imagine sometimes some of the people say that don't lift that much of weight, don't carry this. So if the mother is having a second baby, they have a toddler already with them, they are going to carry that toddler. How much does a toddler weigh? Minimum like 15 to 20 kgs. So if that she is carrying during pregnancy, post pregnancy, just after that, she has to have that strength. And baby itself will weigh somewhere near 2.5 to 4.5 kgs. So you have to have that strength. And later on, the issues of incontinence is something which troubles the mothers. So strengthening those muscles in the pelvic area helps a lot, and which is very much required, need of the hour. Best is to go to a physiotherapist, go to a gynecologist, take a consult, even when you start planning for a baby. It is very important, but hopefully in coming time it will be given as much due importance as it needs.
Yeah, that's right. In terms of planning pregnancy as well, to start with it, apart from pelvic health, how would you go about, giving recommendations as to what to start doing?
Yeah, so we see kids with neural tube defects. Neural tube defect is basically the closure of the tube which makes your spinal cord and your brain joins. So because of the deficiency of folic acid, neural tube defects are very common. One of the commonest is spina bifida, in which the spine basically doesn't fuses. So if the mother starts folic acid 3 months prior to conception, this can be avoided. Many studies, except for the genetic part, of course, if there is a genetic part of it, then you can't do it. But more than 1/3 of such cases can be avoided if folic acid is started prior. Apart from that, USG. So some of the mothers face issues of not being able to conceive, but they never visit a gynec. That why it is happening. They keep on trying. So polyps is another thing which happens, which happened with me too. Like not I just went for an ultrasound just like that. My brother is a radiologist, but my brother told that you have polyps. Because of polyps, either you can have a problem with conception, or you can have even miscarriages. So sometimes the females go through all this ordeal, not knowing that once a USG before planning for a pregnancy can help them keep at least all that ordeal they go through away from them. So that's why the ultrasound before even planning the pregnancy, visit to a gynecologist, what are the supplements required if there are required, understanding all that is very much, and the pelvic health. All these things are very important, which should be considered, and which can be planned, which generally people don't know. They just plan for the pregnancy just like that. So so I'm a big advocate of folic acid starting prior, because I have seen many kids. I have recently seen a kid of spina bifida, maybe 3-4 months old, and that could have been avoided.
Absolutely. And also, so you suggest like going for an ultrasound when you're starting to plan, because even women who have polycystic ovary syndrome, they have problem conceiving as well. So again, like if they were to know this beforehand, that could definitely help them. Okay.
Yeah.
Okay. So in terms of baby's development, what are different milestones in the development of a baby?
So there are milestones and there are inch stones also in between, which the child achieves. So there is so much to it. And about that, I want to say that sometimes what happens is some of the milestones babies skip. And generally what happens is you visit a pediatrician, you visit someone, and they say, even in the family, sometimes they say it is okay for the child to skip a milestone. But according to me, it is not okay. For example, crawling, as we talk about. Crawling, babies achieve in between 7 to 9 months. Nowadays, even kids are achieving by, I have seen recently a kid who started crawling by 5 months also. But there is an age range, so it's okay if the child is up and down. But the point is that crawling helps develop these muscles, the proximal muscles so much, the core muscles so much, that it is going to help them in getting that attention during the studies, in getting that good strength in the hands and the shoulder, which helps in handwriting also. So those things. And yes, milestones, like checking the milestones becomes important, because then you know if something is amiss, and then you can reach a person as soon as possible, leading to that early intervention if required. That is going to help in a long way, because we see many kids which we feel like that, what if they would have come early, the things would have been very different. So that's why knowing about the milestones becomes important. So some of the major milestones, like neck holding, which comes around about 3 months, then sitting comes around 6 months, crawling between 7 to 9 months, then standing and walking. There is for independent walking, even till 16 months, it's considered kind of normal. It is okay if it is delayed till then. But yeah, that's the milestone check. Then even the milestone in relation not just to these gross motor things of sitting, walking, even the speech, like cooing starts around 2 to 3 months, and then the monosyllables start around 7 months, like ma, ba, da. Then bisyllables starts around 9 months, mama, baba, dada. Those things. Then even the social milestone, which is missed so much, because generally parents come to us that my child doesn't walk or my child doesn't talk, but parents miss out that your child is not even looking you into the eyes. Your child is not giving smile to you or to anyone else. So those milestones become also really important to check on, like the social smile that comes around 2 to 3 months. The baby looks at you, smiles, recognizes mother even in the first month by the breast milk smell, by the touch, the feel of the mother. Then they start interacting with the others. There are different type of play which comes. So those milestones are also really important to consider. And they play a big role, like the play plays a big role in their life that way. So yeah, these are
Okay.
the things.
Okay, okay, no, very interesting. And how do you like, let's say, like, a couple comes to you with a baby very early on. So how do you set like, do you set a plan for them? Do you like really guide them into what they should be looking at and when they need to kind of flag things?
Yeah. So if they have already come with an issue, that this is the thing which we are seeing in our child is not happening, which happens if they notice in other kids and then they miss out in their kids, then a proper assessment is done for the child. There are various assessment tools depending on the age of the child, depending on what the problem is. Like there could be a sensory issue, there could be a motor issue, there could be just an interaction issue. And even the early developmental scales in the first year of life are very different from the later on which we follow. Then though that assessment is done, then discussion with the parents, and then we set the goals according to not just what we want in the child, but what the child needs, what the child wants, and what the parents also want. So those things are considered, and then we go about it. So through my page, what I also try is just to tell the parents there are sometimes what happens is small things which you can do for your child. So for example, nowadays containers are very common. Containers as in something, the seats which are there, the bamboo seats or the car seats or the prams, the strollers. Even nowadays there is a seat in which the child, you just make the child lie down on that and just be there. That restricts the motion and the movement so much of the child that the neck movement which had to happen is not happening. They're just lying down there. Then the like tummy time and the floor play are so important, which we used to have as kids. That because of all these new technologies, new toys coming into play, and the marketing for these things are so strong that parents are ought to get confused. They ought to get attracted towards such things which is happening, and that restricts the movement, which actually there is no issue per se with the child, but because the exposure which the baby could have gotten in that age is less, and that could lead to low muscle tone. Muscle tone is basically a feel of the muscle. So they would want to just lie down at one place, play more of a sedentary games, and less of movement play, less interaction with the others, and those kind of things happen. So giving tummy time to your child, giving a lot of floor play, taking them out as much as possible. It's not much possible now with the COVID being there, but if you have a garden, just take them there outside. There have been studies which have proven that less outdoor play can even lead to visual issues. It can lead to myopia. So more of outdoor, because they don't see actually far when they are inside the home. Outdoor they see far, so that develops their vision. So that's why outdoor play and those things. So these kind of discussions we have with the parents plus the play. Generally what happens is that parents come to us that what are the exercises we can do, which exercise, which muscle we have to strengthen. But what actually we should focus on is play. That for the child during the first 5 years, most they learn is from the play. And that's what we interact with the parents, that you just focus on that this is the play which the child does in this age, and just play with them. And play with automatically bring the motor, the sensory, and all those development in place.
Yeah. No, that's really, really interesting. Like, yeah, you wouldn't think that way. So let's say if they're not coming with the problem as such, is there a way you get them started to think, say, okay, this is how this should really take place?
Yeah, so sometimes we use some scales, like there is a sensory profile, or maybe there is a developmental checklist, because it happens. It happens even if lot many times it happens that uh, mother has that sixth sense. Mother knows that something is just not right with my child, but they get suppressed when everyone around in their family is like, no, it happened with his father too, or it happened with this one in the family too. It is all okay. It is all fine. And then it becomes difficult for mother to approach anyone.
Yeah.
And sometimes even if they are able to convince the family, they come to us, still it becomes difficult for them to continue that thing, because they just, cover up the whole thing. No, this happened to that person and this
Yeah.
person.
Yeah.
Then we talk about the developmental checklists with them. Does your baby does this? Does your baby
Okay.
doing this or that? And then somewhere that doubt comes in the family.
Mm.
And yeah, it does take sometimes few sessions and a
Yeah.
longer period of time to
True.
convince the other in the
Yeah.
family.
Yeah.
Sometimes it takes years and years. It's only the mother who's struggling hard, to bring the
Yeah.
child,
Yeah.
to help the child.
Yeah.
So yeah, we try to show them the researches, the papers, the other kids and the videos,
Yeah.
and then try to convince them.
Yeah, yeah, it's a lot to do with the conditioning, isn't it? Like,
Yeah,
in our, like, especially in Southeast Asian families, we are like,
yeah,
oh yeah, this has happened, so it's okay, yeah, we're
yeah,
not, we just like to stick to our own ideas of how
yeah.
things should be. Yeah, no, that's really, really interesting. And I'm sure, Gagan, a lot of people will benefit. And like I said, I'll be sharing the details. And your page is very interactive. And I really, really like the idea of, what you're doing. So thank you so much for that. Is there any other advice you would give to new parents, with the motor development, for example, like, what signs to look for, or, what the general idea should be. Like, for example, I really like how you said that there should be more time for them to play, the floor time, or taking them outside. So yeah, is there any other general advice you would give?
So parents are very scared of the tummy time. Tummy time is something I'm in a big favor of developmentally, which works with all the systems, not just the motor, but the sensory, like
Sensory,
your
yeah.
sense of movement, like vestibular system, which is inside the ears, that tells us about where our position or while moving, where we are in the space, then proprioceptive system. So all that works with the tummy time. So even when you are starting, like you have a newborn, at that time you are scared, how can we put the baby on the tummy?
Yeah.
You can take the baby on tummy on your chest, you
Chest,
can
yeah.
take them on your hand, you can take them on your lap and give them tummy time. Then when they're around 2 months, they will start to take head up to 45-degree. They won't be able to sustain
Lift
it,
it.
but they
Yeah.
will be taking it up, keeping it on the side. And
Yeah.
sometimes it actually is not, a child might cry, so you can give it in breaks. Give it for 5 minutes, take them on their back, then again put them on their tummy for 5 minutes, then put them on their back. And you can give them, as I said, in various ways, on your hand, on your lap, on your chest,
Yes.
that way. So then floor play is another thing which again parents get scared of. How can we leave them on the floor? But exploration is one thing, like just like play, exploration is one thing which helps them to learn to problem solve,
Yeah.
to be more confident.
Mm.
So let them explore. Yes, there are baby proofing equipments which come if you are scared of that they might hurt themselves. Then you can have those baby proofing equipments, like there are door guards, then
Yeah.
there are corners and edges
Yeah.
to keep these things away, and
Yeah.
keeping those things which, like books and all, a little downwards, and all the things which can be broken off a little up.
Yeah.
And so those things you can do and let them explore. If you want to make a play area, make a play area for them. If you are scared that this might the keeping all the area open is a little difficult for you,
Mm.
then just make a play area with guarding, putting guards all around it, keeping mats. You can have various textured mats, even pillows and cushions around all the obstacles which they have. Like for example, if the child is trying to crawl, then they can crawl over those things.
Yeah.
um, uh, then something which comes to my mind, one thing is, as I said, the mother has the sixth sense.
Yeah.
So this is a message to the mothers. If you feel anytime that there is something which I want to check about, then do reach out. Don't keep it to yourself.
Yeah.
And
Yeah.
most of the times it is nothing, I understand. But if it is something, don't feel scared, don't feel judged. That is another thing which happens a lot, that the mothers are judged so much.
Mhm.
And it is okay if the mother doesn't know everything. everything. You can't actually know everything. It's just fine. So don't, get overwhelmed with all that thing that I should have known, I could have done better, and I could have been this and that. So that is another thing, another message I want to give to mothers. Then about like motor play is from a lot of tummy time. Then even when they're on their back, like around 4 months, they start reaching for their knees, which develops their abdominal muscles a lot. Around fifth month, they reach for their toes. They put their toes into their mouths. That also develops their this, and plus the midline crossing start. So there are sideline tummy time. Sideline is another very important or very good position which helps develop the muscle. So in sideline, both these muscles, the front and the back, are working together, and that is called co-activation, and that also works better. Plus they come into that midline play is also very good. It basically we have two parts in our brain. So they pass the information from one side to other. So when the midline, they come into midline, that information is brought together. Both the hands are working together. That way, even the midline crossing, when this is the midline and they start crossing it, in sitting, that will be around 7 months. In lying, that will be around 5th month, when they'll be reaching for their opposite foot. That is also a very good way of, that bilateral integration which happens between both the sides of the brain. And that is also very good. So you can use towel rolls under them. You can use towel roll behind them to keep them in the sideline if they are not able to. You can keep towel roll under them to help bring their legs up if it is getting difficult for the child. So that way you can do those small things, small modifications to help them achieve those milestones. Most of the times they won't even need it if you just play with them. Another message I would like to give is about the toys. So toys also play a very important role in a newborn's or a baby's life. Like in the first month, black and white color is something which actually stimulates the visual system the most, because that is the color they can see. So you can have black and white patterns all around them, and then gradually going to colors. So having colorful toys is going to stimulate them more later. Keeping the electronic toys to minimum and simpler toys more, because with the simpler toys, they'll have variety of play. And that gives a lot of learning. That because nowadays, again, electronic toys are so much and there's so much marketing that again parents gets confused. But simpler toys are going to bring more of problem solving, more of learning for them, being independent, and those things, confidence, building up confidence and those things.
Okay. Yeah, no, that's really, really interesting. Thank you so much, Gagan. Yeah, I learned so much today. And I'm pretty sure that, the viewers will really appreciate it. And if I get any questions, any follow-ups, then, we can talk about it and then probably do another session at some point. But I really, really appreciate your time today. And thank you so much. It's been so informative. Thank you very much.
Thank you so much, Jagjit. It's you're doing a wonderful job. You're doing this wonderful work, and I really, really appreciate it.
Thank you.
Thank you for making me a part of it. Yeah.
Absolutely. Thank you so much for all your support as well, Gagan. Thank you. And I will be in touch again. And, let's keep in touch and, keep this going. Thank you. Take care, Gagan.
Bye. You too. Good luck. Thank you.
Thank you. Bye.